So, hey everyone, I'm Lauren Fleming, and here today I'm with Dr. Kaleigh Mulpeter. She's a physical therapist, educator, and community builder, and we are so excited to have her here talking with us today. So, welcome, Kaleigh. Thanks for being here.
Thank you.
Can
Thank you
you,
so much for having me.
would you mind telling us a little bit about your background and kind of what steered you to be on the path that you are on today?
Yeah, sure. So I am a physical therapist. So I went to PT school, but before that, I was a yoga teacher actually for about over 10 years at that point. And before that, I was an athlete and a dancer. So I've always been really interested in movement and particularly movement as a healing modality. So eventually through PT school, I started learning more about pelvic health, although not as much as you would hope you learn in PT school about pelvic health, but kind of got my toes wet and got interested. And then once I graduated, I just realized that's what I wanted to do. So I started doing a lot of continuing education, taking lots of workshops and courses, and just kind of hit the ground running with it. And it's awesome. I love what I do. I work with all sorts of different people, pregnant people, postpartum, folks in menopause, folks who've had gender affirming surgery. So it runs the gamut. And yeah, it's a good time.
Great. Yeah. Thank you so much for sharing that. Will you tell us a little bit? So you're kind of touching on it or starting to, will you tell us a little bit about like what your day to day or week to week looks like in the work that you do?
Yeah, it's pretty varied, although specifically at my practice, I am kind of niched into perinatal care. So I will kind of arrive at my office, get all set up, and I just get the ball rolling, seeing folks back to back. I usually see 6 or so people a day, and it's a big variety, which is fun. So I might see someone who's really pregnant and we're doing birth prep and I'm helping them manage pelvic pain. I might see someone postpartum. Sometimes folks bring in their little babies. So they and their cute little ones come in and we work on postpartum rehab. And that's not just pelvic floor. We might work on abdominal coordination, neck pain, wrist pain. There's lots of things that come up for postpartum. And then I might also see even folks who are younger, like sometimes teenagers or college age people who are dealing with issues like painful intimacy. So it's a big variety. And I work with folks on movement. We do manual therapy, a lot of education. So it's always something different. And that's something I really appreciate, pelvic health.
Yeah, great. Thank you. One of the things I think about a lot, especially is like, I feel like there's more awareness coming around pelvic health. And then it, of course, is one of those things where pelvic health physical therapy can really like help address so many things, and folks may not even begin to understand kind of that full gamut. How would you explain the importance of pelvic health to somebody who's either like never heard about it before or maybe has like a very basic understanding?
Yeah, I think I would start with the statement that everyone has a pelvic floor. So, just like any other part of your body, sometimes the pelvic floor can be involved in an issue or an injury. Even people with back or hip pain, sometimes the source or a contributing factor to that pain is coming from the pelvic floor. So, you want to work with someone who is well versed in assessing and then treating that. And then I think another way to get through to folks how important the pelvic floor is to remind them that your pelvic floor helps keep private things private, like your ability to empty your bladder and your bowels, to control gas, to support sexual function. All those things involve your pelvic floor.
I like that you started off with everyone has one because it's been interesting, like since I like will tell people about, creating the garment and like what is it for? And the women who I talk to, like, or most people in that space are like, okay, yeah, I know exactly what you're talking about, or they have a general idea. And I feel like when I talk to men, it is more like, well, who does this apply to? And they have like, I don't feel like they feel like they have a pelvic floor. And I'm like,
Yeah.
everyone has this. Like, so it's been interesting with me being newer to the space, having those conversations and starting to see what people's perceptions are for sure.
Yeah, definitely. I think that's something that's lacking in the pelvic health sphere actually is more education for men
Yeah,
and children and intersex folks. Everybody has a pelvic floor,
right,
despite your gender or your sex. So
right.
I know, I think we need to do a better job on educating people who don't have vulvas that they have a pelvic floor
Right.
too. And actually
Exactly.
a lot of common pelvic floor issues like erectile dysfunction or other intimacy issues or urinary issues. I mean, it's stemming from your pelvic floor, and folks just don't know enough about it to identify, oh, maybe that's a pelvic floor issue. Maybe I should go see a pelvic floor professional.
Right. Yeah. So along those lines, I know also that, there can kind of be like the one-liners that can get out there, and then that's kind of what's pervasive. And I think a lot of times it can be like myths or misconceptions. What are some of the top misconceptions or myths that you see, that you kind of like have to actively work to combat in the community?
Yeah, I think the biggest one is that a pelvic floor issue like urinary leakage, for instance, or incontinence is due to a weak pelvic floor. And the answer is always to do pelvic floor contractions, AKA Kegels. It seems like Kegels are like, luckily, we're getting more and more info now with social media being so robust. But I think in the past, the message was always, oh, you have an issue with your pelvic floor, squeeze it over and over.
Yeah.
But if we recommended that for any other part of the body, you would be like, do you really know what you're talking about?
Right.
Like if someone had hip pain, you wouldn't tell them, yeah, just sit down and just squeeze your butt over and over, and that should take care of the issue. So yeah, I think that, dialing it back again, issues are not generally just from the pelvic floor. The pelvic floor is part of the system that is your body. So sometimes an issue like even leakage could be because of something happening with your foot mechanics or your hip mobility or strength or how you're breathing or your posture. There's so many different factors that can influence the pelvic floor. And the answer may not be just make it stronger. We have to look into, well, why is there so much burden being placed on your pelvic floor that's causing the issue?
Right. Yeah. I love that point too, because I feel like that's the other piece is it can feel like, oh, you're only focusing on this one thing that like may or may not be functioning properly. When it like the point you're making is it's this whole body system, and your pelvic floor is a crucial part of it, but then they all, I don't know, interplay together. So it's so important to at least have a high level understanding of what the options are so that you can seek the proper help and at least get pointed on, in the right direction when you start to have things, go in a way that are not ideal for you, kind of a thing.
Yeah,
That's great.
absolutely. And I think any good pelvic health provider is, looking at the whole body, the whole system. Because sure, like someone's issue might go away if they're just strengthening their pelvic floor, but as soon as they stop doing Kegels over and over, it might come back and they're frustrated. Like, why is this happening?
Right.
So yeah, we have to look at the whole person. We are more than just pelvic floors.
Right. And I know too that, one of the things that's so great about, pelvic health physical therapists and pelvic health professionals is that a lot of times, you all are in a space where you can give a lot of, one-on-one attention and very like specialized, individualized guidance. Are there like best tips or practices that you would recommend that are more applicable to a general population without having to be as individually tailored? Like if I'm just thinking, okay, how do I kind of keep good pelvic health in mind, or between like habits, exercise, movements, practices that are just kind of good things to keep at the front of my mind in my day-to-day activities?
Yeah, definitely. No, there are absolutely some just general recommendations I could make that can help support everybody's pelvic health. The first would be get enough fluid and fiber to support healthy digestion, because constipation can strain your pelvic floor. So supporting, stool that's easily passed and healthy, happy, easeful bowel movements is a great way to support pelvic health. Another one would be stay active, because your pelvic floor muscles are primarily involuntary. They should just engage when they need to, and they turn on when your body is moving. So if you are generally active in whatever makes you happy, walking, yoga, strength training, you are taking care of your pelvic floor strength as well. And then another would be to address stress. We tend to hold stress in a couple places in the body, most commonly the shoulders, which I'm sure a lot of people are like, yep, that's me, but also the pelvic floor. We just tend to have less awareness of the pelvic floor, so you might not be noticing that, but your pelvic floor tends to clench when you're feeling stressed or afraid or overwhelmed. So managing stress and anxiety and really thinking about that whole being health again, that whole person health, is supportive of your pelvic floor.
Thank you. Will you speak a little bit to how your pelvic health needs like may change as you're going through different phases of life? So I know a lot of people might first kind of get keyed in on this during pregnancy or early postpartum, but then as you shift into perimenopause, menopause, postmenopause, will you just talk a little bit about that journey?
Sure. Yeah. I mean, pelvic floor issues can present at any point in life. I mean, for a lot of folks, sometimes it has nothing to do with pregnancy
Hmm.
because the pelvic floor is influenced by so many different systems. So, but we can focus on pregnancy and postpartum and menopause because those are such big landmarks in life for so many folks. So during pregnancy, your pelvic floor is really being burdened by a lot of increased force moving down on it. And so pelvic floor specifically may need some support in perhaps strengthening, but usually it's offloading the pelvic floor. Like, what other parts of the body can we strengthen to help support your evolving body so the pelvic floor doesn't have so much work to do? And then postpartum, whether you're recovering from a vaginal delivery or a cesarean, you'll need some help in recovering from that almost year-long stretch of being pregnant. And then perhaps there was also some changes or some injury that occurred during delivery that we need to support healing as well.
Right.
And getting back to activity when you have a small child is no small feat. So having some
No.
support with that is great as well, because you don't want to just go from 0 to 60. You don't want to do nothing for 6 weeks and then all of a sudden go back to your regular activities at 6 weeks. You really want to have a progressive approach back to activity. And it takes much longer than 6 weeks for that full recovery to occur, and that's normal. And then as you approach perimenopause and menopause, your estrogen levels change, they decrease. And your pelvic area has a lot of estrogen receptors. So as that estrogen in your system decreases, the tissues in that area can change a bit. Things can become a bit thinner, there's less circulation, there's more sensitivity. So as you age and your hormone levels change and probably your activity levels change and your general
Mhm.
health evolves, things can shift with your pelvic floor as well. So a pelvic PT or OT or a different pelvic trained provider can help support you at any stage. I think if you're having any issue like pain, leakage, heaviness, anywhere in or around your pelvic floor, that's the time to reach out if you feel comfy doing so and get some support.
I think that hearing like those different phases can be really helpful because I think sometimes, especially if you aren't as familiar with like what the resources can be, it can feel hard to even know where to start, or you just kind of feel like, well, this is just part of aging, and this is how it goes, which I think is another kind of myth that you hear. And so, yeah, just getting to hear that, like, hey, as you progress through these different phases, there are certain things that you can many of these things that you can get support with. And yeah, talking to pelvic trained professionals can really like put you back on a path to live comfortably and happily and do the activities that you enjoy doing. So I love getting to hear about this in the different phases because I think it just helps like normalize this and destigmatize these topics that I think can often impact people, and they just feel alone and don't know necessarily what the options are to find help.
Yeah, absolutely. And I think we're met with a lot of casual mentioning from older generations of, oh yeah, I just leak because I had kids, and
Yeah.
like folks tend to make light of it, which is understandable. You're
Yeah.
using humor to
Right.
help cope with this shift that has become inconvenient but part of your day to day. But the reality is you don't have to just deal with that. You shouldn't have to deal with pain or leakage or heaviness at any point in your life. We have lots of information and resources now for folks.
Mhm. Great.
Mhm.
One thing I did want to ask you about, if you feel comfortable sharing, would be telling us about a success story that you've had with somebody that you've worked with.
Yeah, I'm happy to say there have been lots. One that comes to mind is a client I was working with who has a vaginismus diagnosis. So that's the involuntary kind of spasm of the pelvic floor
Mm,
muscles when trying to insert something, and
mm,
associated anxiety with the idea of inserting something. So a lot of difficulty with gynecological exams and tampon
mhm.
use and intimacy. And we worked together for, I want to say, about a year, and then she became pregnant, and then I supported her through her pregnancy, and then I supported her postpartum. So that was an awesome story because I just was able to see her really come full circle, and it's a good example of how I could support her pelvic health in lots of different ways through
Yes.
different stages.
Amazing. Yeah, thanks for sharing that. Well, I think it's so important too to hear the success stories, because if you're somebody that's experiencing that, or another anything that can feel like debilitating and where you don't have necessarily certain choices, it's so great to hear that you can work with someone and have like this long ongoing relationship of support the entire time. So yeah, so that's so I don't know, makes me feel hopeful for those kinds of situations. So thanks for sharing
Yeah,
that. Appreciate it.
definitely. Definitely.
And another thing I wanted to ask you about is just kind of thinking about, as the space continues to evolve, what are some of your favorite ways to try to work to stay up to speed on, the latest advancements or innovations?
Yeah, I mean, like anyone working in healthcare, you've got to stay on top of it
It's a
because
lot,
new research
I would
is,
imagine.
yeah, yeah, like new evidence is always coming out. And really, to remain a proficient provider, you have to stay tuned into that. So I'm part of a lot of different groups online that bring up new research. I'm continually taking courses and keeping up on my continuing ed, and those leaders in the field are always staying on top of things and presenting that to us. And I may or may not have my Google alerts on for anything that comes up on Google Scholar with the keywords pelvic health or pelvic floor.
There you go.
So yeah, so that's how I do it. I just try to kind of keep my finger on the pulse, so to speak, and not obsess over reading every single article, but
Sure.
I definitely try to maintain contact with other pelvic providers so I can just be in conversation about how things are evolving as we learn more and more.
Great. Thanks for sharing that. When it seems like, the more and more people I talk to in this space, it seems like such a collaborative community, and that it seems like kind of the inner motivation of a lot of the people I've talked to is that continual learning. It's like, of course, in healthcare that needs to be there, but I
Mm-hmm.
don't know, I get the feeling that it is kind of the more passion of people in this space, where it's like, it's not like work when you're doing that. It's like you get to continue to learn and evolve, and yeah, I don't know. It's neat to see that.
Definitely. No, I think so. I think that pelvic health providers are a different breed
Yes.
because you can't go into this field feeling like, yeah, I kind of like it. you
Right.
know, I
Yep.
mean, you're probably pretty passionate about what you do. And I think what keeps us passionate is how grateful our clients are because you're really
Yeah.
helping folks through really vulnerable times and you're working with them on issues that perhaps they haven't really spoken to anyone else about, maybe just like their partner or their primary care provider, but they may feel pretty alone in what they're going through. And so the ability to help someone through that and to be feeling confident in their body again is a
Yeah.
gift. And I think that's what keeps us
Oh,
rocking
thanks
and
for
rolling
sharing
in the
that.
pelvic health space.
Yes.
Yeah.
Another thing that I was thinking about as you were saying that is, I also wanted to get your thoughts on how, for people who have, either partners or close family members or friends, how can they lean on some of those people to help them during these times? Because it can feel so lonely and isolating, and like it's all on you to work through these various conditions.
Yeah, definitely. I think the biggest thing that a partner or a friend or a family member can do for someone who they know is going through pelvic floor rehab is supporting them in getting to their appointments and supporting them in doing their home program, helping them to not have to like fight for that time
Yeah.
is huge. And I'm
Wow.
especially thinking of my postpartum clients who
Mhm.
are so tired, they're so busy, there's so much going on at home. And I see such a difference in the folks who have supportive partners who are
Yeah.
encouraging them to get treatment and encouraging them to do their stuff at home and really like creating space for that versus the partners who aren't. So I think you've just got to have someone who logistically is supporting you getting through this.
Well, yeah, it's something I feel like it's things like that that on the surface might not seem like a big deal, but especially for new parents when you're juggling all of these things, like simply having somebody say, no, you go do this, take time for this, I will take on this other thing, can go a long way.
Yeah.
Especially in a culture where I feel like we don't ask for help as often, and that might feel like more uncomfortable. You're like, no, I can do it all. I'll figure it out. I've got this.
Oh my
And
gosh,
that can, yeah,
totally.
be really difficult.
Yeah, especially moms, that mom guilt
Yes.
of like not wanting to take time for yourself. But yeah, having someone who's encouraging you to do it and who's saying, no, you're important, you matter, is huge.
Yeah, that's great. Thanks so much for sharing that. Another thing I feel like I've kind of come up against is people who might feel hesitant to seek help. Like they know they have something, they know, oh, maybe I could work on it, but for various reasons, they might seem hesitant. If you were in, just a casual conversation with them, what would kind of you say to help encourage them to potentially reach out?
Yeah, I think that's such a great point because it takes some bravery, I think, to go to a pelvic provider and say, hey, I need your help with this. I think first and foremost, you have control over your body and you don't have to do this if you don't want to. And it's also so important that you're working with someone who you feel comfortable with and who is really asking for your consent throughout the time working together. So if you have, a first visit with someone and you feel like you didn't really jive and, oh yeah, they just kind of said, okay, take your pants off and hop up on the table. Maybe that's not the provider you want to continue with, and know that you can
Yeah.
always decline any of that internal pelvic floor assessment or treatment. I've definitely worked with folks who are not comfortable with that, and that's fine because luckily the pelvic floor is influenced by lots of other things. So we can still make progress without direct pelvic floor treatment if that's not something someone's comfy with. But I think encouraging someone to just either have a phone call with the provider first to get a sense of things, ask questions, or meet them initially before jumping into like a full treatment plan is a great idea. And it's very valid to want to do that.
Thanks. Thanks for sharing that, because I think it's also helpful for people to hear from healthcare professionals that it's okay to just do the phone call or to just kind of do like an interview or like a first thing, and then to have that check in and be like, does this feel right for me? And if not, switch. Because I think sometimes too, folks can be like, well, I've met up with this person and that's my choice and who I move forward with. So I think it's really helpful to hear, that you can pivot and that it is in your control to decline certain things. And just because they say, hey, let's try this or do this, doesn't mean that you have to say yes to everything. Because I think that's another like anxiety that folks that may have them be feeling hesitant to seek care. And when you get to hear providers like yourself be very like empathetic and listening and supportive of those kinds of choices, I think it just helps more and more people feel more brave, to reach out if they are feeling hesitant. So I think that that's great.
Yeah, definitely. It's so important.
Thank you. One other thing I did just kind of want to check in with you on, like, as we're wrapping up, is there like kind of like one thing you wish folks knew about pelvic health, or kind of like a soapbox item that is, kind of your favorite to talk about?
I feel like we have touched on some of the important things, like Kegels aren't the answer to everything, and everybody has a pelvic floor, and your pelvic health is about more than just your pelvic floor. But I think the biggest thing I want people to know is that pelvic floor issues are common. You're not alone, but peeing or having heaviness, or I mean, peeing when you don't want to be peeing, or having heaviness or pain with intimacy, that's not normal. And you don't have to just deal with it. There's lots that we can do to support you and get rid of those symptoms.
Thanks for sharing that. So I'll wrap us up here for today, and we appreciate you taking this time to talk with us. Thank you so much, Dr. Kaleigh.
Yeah, my pleasure. Thank you for having me.